What's up, happy people? I am so excited because it's our last and final webinar of 2021. That's not why I'm excited, because I'm going to miss y'all next Tuesday while I'm on vacation. No, I'm excited because Heather's here. And in case most of you probably know Heather, but she is a network specialist with ChiroHealthUSA. She's our go-to girl for how to set your fees. And there's lots of people who can teach you how to set your fees. But the cool thing about Heather is that she's going to tell you how to set your fees to make care affordable for your patients and put some money in your pocket, because it's all about generating revenue for your practice. And I don't know how she works her magic, but every time I hear her talk about this to groups of people, my mind is just blown. It was so awesome that I got to be in the room with her in Clearwater, Florida in October when she taught this to the top women chiropractic professionals in this country, and the feedback was just phenomenal. She really is today going to open your eyes on your fees, setting your fees, but on top of that, she's really going to help make 2022 like the best year yet for your practice. Welcome to the webinar.
Hey y'all. So my goal is to make this quick, because let's just face it, it's the end of the year. You've either got lots of patients to treat or you're going on vacation, whatever it looks like for you. I'm going to make this as painless as possible. So we're going to just kind of dive into everything. Going to share my screen here and we're going to rock and roll. All right. So honestly, who cares what you charge? You absolutely should. One of the things that I've been doing with ChiroHealthUSA over the last 10 years is just really getting to know this profession, and it is incredible. It hands down is one of the most incredible things for me to be a part of. I get to travel across the country. I've met a lot of you likely, and will continue to meet new doctors along the way. Christy and I do this. I would say we do about 40 trips or more a year, give or take. It's fun, but I get to work with thousands of practices, over 2,000 practices. I am absolutely devoted, is probably the best way for me to say this, devoted to seeing your practices succeed. That's it. It's where I am. I am straightforward. I am honest. You're going to get what you get. Oftentimes practices hear me say I'm going to use my mom voice. So I'm going to do my best to give you the best interpretation of my mom voice throughout this quick presentation. So first things first, you need to know your value and how to determine your value. So the first thing any practice needs to do, whether you have a practice that's been established for 30 plus years or you are about to open your doors, you need to know your number. So there's a lot of things that kind of go into doing that. And it's just knowing your overhead cost. What are your overhead costs? All of that's going to translate to being profitable. So typically in practices, it's around 50%, and that might actually be a bit higher because of COVID. Different things kind of come into play with that. I've seen practices with their overhead as high as 84%. This practice particularly was essentially paying patients to come in to the office. So knowing your number is going to help distinguish so much for your practice in 2022 to be profitable. But it's as simple as an overhead calculator. This is something that I don't know if Christy wants to post this link into the chat bar so that you guys have access to it, or we can send it over to you, but it's really quick and easy. It's basically gathering a few numbers, your total yearly income, kind of input all this stuff into here, and it gives you all of the examples, the breakdown. And as you guys can see on this particular one, their number is what I would say. What is your number? $19.79. So I'd say round it up to $20. So averaging all of these costs and putting this together helps you become profitable. All right. So I commonly see the practices that I work with CHIroHealthUSA. And by the way, I'm pretty good. So if we were face to face or we were having a conversation, you kind of gave me a breakdown of your numbers. I'm usually really good at within $5, maybe $10 at guessing what your number is for your overhead. So That being said, $40 is kind of the norm that I see. It doesn't mean that it's your practice by any means, but I see that number be the most common number for practices. So about $40. Why is this important? This is the minimum that you must collect to just break even. I had a doctor that I was working with, and he had no clue what his costs were. And by the time that we broke things down, he was literally making 66 cents per patient. 66 cents. Had no idea what his number was. He was not being profitable. We fixed some things, and he had his best year yet last year. The cost of living increases, guys. This is something that you really need to pay attention to. Your numbers are going to continue to change. And as Christy spoke about a moment ago when we were at the conference there in Clearwater, Florida, it really got the attention for women when I said pork chops. Pork chops. The price of food, all of this has gone up. It's changed your income. All of these things have changed. So you need to know your number. And my example to that group was simple. Grocery store a year ago, a pack of pork chops, I was paying under $10 for a pack of pork chops. A couple of months ago, that price went from $10 to over $17. So know your number. But better yet, how much money are you actually leaving on the table every year? Thousands and thousands of dollars. So biggest question is, Heather, now that I know my number, I know this, I've got my overhead figured out. How do I actually set my rates? How do I set my rates according to what industry guidelines are? All of these things. So here's some tips. First and foremost, please, sweet baby Jesus away in a manger. Do not put a baseball cap on and walk into practices posing as patients. That is a true story. Bless her heart. Don't have your team call other practices asking them what their numbers are. In other words, how much does it cost to come in? Secondly, just don't pull numbers from out of the air. Don't do it based on the emotion of the area. Don't assume what patients can and can't pay. And don't set your rates based on fear. It's so important within our profession to know what your worth is. Again, quit leaving the money on the table. Another thing we look at oftentimes with insurance, right, is the reimbursement rate. And I hear this all the time. Insurance doesn't pay squat. But you're not looking at what you're submitting to insurance companies. And if you aren't paying attention to that, how would you ever expect an insurance company to even pay you more when you're probably leaving money on the table? So review your provider agreements. Every one of them are different. You need to review them minimally yearly. I always challenge practices. Why would you even sign a contract for the cost is less than the cost to deliver care? You need to know what services are covered, what services are not covered within your provider agreements. Payers even allow for updates throughout the year. So this is something, if you're not reviewing them at all, review them annually, if not, twice a year at least. Set your rates higher than what insurance companies are willing to reimburse you. My opinion is a minimum of 200 to 300% of Medicare is typically best. I'll give you guys a pretty good example. If you bill $125 and they're willing to pay $150, then you're just going to get $125. If they update and now they're willing to pay $175, but you still bill $125, you're only going to get what? $125. So set your actual fees, for example, at $200 or higher. So quit leaving money on the table. Please, please, please quit leaving money on the table. A practice I worked with, PI practice, looked at some different things. In a month, $13,000 was left on the table. $13,000 was left on the table. Then I've got practices that assume practices from other doctors. For instance, I've got a practice that assumed a whole clinic took on everything, and this particular doctor had not updated or reviewed their fees in 10 plus years. Now, this doctor is kind of stuck with, how do I make these changes? What do I do? Where do I go from here? If you're scared to make the change, which totally get, I understand, then here's another option for you. I call it the $5 a year. So I want you just for a second to imagine raising your rates by just $5. $5, guys. In a 12-month year, that could actually equal a 13-month revenue cycle that you didn't have to pay for. You didn't have to treat more patients. You didn't have to pay for more marketing. It genuinely can be as easy as that. If you're scared to do an overhaul, consider raising your rates just by $5. $5 gives you a whole additional month of income. So there are even statistics show that clinics are not charging as much as workers' comp is willing to reimburse. Practices aren't even charging what workers' comp is willing to reimburse. I see this every day. Personal injury, those carriers pay near or at least 100% of what you bill them. There are even countries, carriers using data from other countries outside of the United States to set their usual and customary rates. We have to do a better job in this profession by setting our actual fees. Again, do not have your team call posing as a patient to other clinics. Price fixing, big trouble. There's lots of layers that go on with that. So be careful here. So I'm going to give you some resources as we move forward on how you can do that. So first, fairhealthconsumer.org. This has been around for ages. This, in my opinion, and everything that I'm giving you is in my opinion, or I've worked with consultants throughout my time here at ChiroHealthUSA, fairhealthconsumer.org. This is absolutely wonderful for your medically integrated, your multi-D practices, because it kind of allows you to do a search based on the individual CPT code. Here's the downside. It's free for you to look for your first 20 searches within that week period. Here's your get around for that, by the way. Switch IP addresses. So if you're on your mobile phone and you do some searches there, you can get away with it. Different IP address on home Wi-Fi versus work Wi-Fi, whatever it is, or coffee shop if you're just looking up numbers. So that's kind of your workaround to getting around the minimum of 20 searches a week. So again, it's based off of a CPT code. This is based off of your zip code. So Mississippi practices are going to have different numbers from a New York or California or Florida. So it is based on your zip code. So zip code specific. My absolute favorite, hands down, is ChiroCode. ChiroCode offers lots of resources within this profession, but this one is kind of a hidden gem, and it is proven valuable for so many practices out there. So on their website, guys, you just see their menu bar at the top. It says tools, and under that, you're going to see chiropractic fees calculator. Again, specific to your zip code. You're actually going to punch in your zip code for this one. And here's what the beautiful thing is. It's freaking unlimited searches. So it's not going to, tell you have only so many searches within a week. It's just there. Better yet, it's going to produce all of the CPT codes that are most common within chiropractic. And some you had no idea even existed. It is all based on the Medicare guidelines, which I absolutely love. So it's going to populate in a column Medicare. It's going to give you 150% of Medicare. It's going to give you 200% of Medicare. That doesn't mean that you have to set your rates at what it says on their website. Again, it's a guideline for you. A lot of practices are charging under Medicare. Under Medicare. And I think that's so critical to make sure that your services are being valued by your patients. So ChiroCode.com is phenomenal. If you want to go above 200%, go for it. That's not up to me. That's up to you. Actually, a lot of my Florida practices are hitting somewhere between 300-400, sometimes higher. Just again, depends on the demographic. All right. So there are states that actually publish workers' comp fee schedules. Oregon comes to mind. I have a lot of my Oregon doctors that utilize that published fee schedule by workers' comp as their avenue of setting their actual fees for their practice. So if your state publishes that, I think some states you can purchase it too. So there are other avenues outside of those two websites that you can utilize within your state specific. And then there are consultants. I get the opportunity to work with so many incredible people through ChiroHealthUSA. Dr. Evan Gwilliam, he's wonderful. I know Kathy Mills-Chang with KMC University. They do a lot of fee schedule analysis with the RVUs and kind of dig in with that. So if you've got a coach, if you've got a consultant that you work with, maybe they have an avenue that they can assist you with setting actual fees. You just need to charge what you're worth. So those are some of the resources that you guys have to begin looking at the overhead calculator, to begin looking through Fair Health Consumer or ChiroCode, or working within your state as well. All right. So then the biggest question I get when doctors look at it and go, oh, I've only ever been charging $50 for this service. But here it says I should be charging $125. And then they have that moment of sheer panic that says, Heather, my patients are never going to pay for that. I get it. I understand. So I need you to breathe. Increasing your rates can absolutely be scary. No one said that it was going to be easy. No one said that it wasn't going to be scary. Change is something that a lot of us are resistant to. Totally get it. Something that I've seen throughout the time within chiropractic is that DCs are some of the most compassionate people out there, and you don't charge for a lot of your services. I actually had a conversation with a doc yesterday that he did a thorough exam. He performed modalities, but he never charged for any of them. He wrote them off. He only ever charged for his adjustment. He's leaving money on the table. It's lost revenue, not to mention all kinds of fines and penalties, and we're just not going to go down that road. But that's lost revenue. So many of practices judge a book by its cover. And my granny told me to never do that. You can't assume anything. It often happens with Medicare patients specifically. There's literally nothing out there that says a Medicare patient can't pay for services. By gosh, they can. Most Medicare patients could probably walk in with cash and buy your practice today if they wanted to. So don't assume someone can't pay for services. Then I challenge my practices or anyone that I'm meeting that says, do you already have a cash fee for services? Are you bundling and giving things away? Like the doctor I recommended a minute ago, just giving it all away, just the whole store. Just take it. Just take it. How much of your practice really is cash? There's numbers out there, statistics show that practices are typically 80% insurance. That includes PI, workers' comp, Medicare, and your third-party payers. 80% of practices are typically insurance-based. Do your patients even have a clue the value of your services? Do they even know that they're getting discounts? Are you being compliant when it comes to those cash discounts with those patients? How are you setting that up? Often practices state that they really are a cash practice, when in reality, we have this conversation, they're not. They're not. So there are many avenues that you can be super profitable, but you just have to do things the right way. So it's about setting the table for the practice. So then I say, should you be discounting? And practices this is really fun when they'll say, no, I don't do discounts. Discounts. And Christy's been with me, and I'm like, okay, great. Don't do discounts. That's fine. And then I ask them just a few questions that I've kind of figured out over the years, and they're like, yeah, I do that. I'm just like, well, you're discounting. It's not right. So there's nothing wrong with discounts. Let's be very clear. There's nothing wrong with discounting your services. Actually, are you in network with insurance? Do you accept Medicare? You're accepting discounts at that point. Do you offer a hardship policy? Had a doctor, ironically, another one yesterday. Yesterday was a good day for conversations. Anyone who wasn't insurance, not insurance, right? Deemed cash, he put them under a hardship policy. Never verified anything. So do you have a compliant hardship policy set up in your practice? That's super important. And that's something that we're happy to share with you guys as well. So we can send that information over just to make sure that you are documenting that you have a rock solid policy for all these things. That even comes down to a professional courtesy policy. Oftentimes doctors will just put groups of people under what they call a professional courtesy policy just so they can write off services. That's not how you do it. So make sure that you've got, again, rock hard policies that you've got in place that will support what it is that you're doing. KMC offers a phenomenal kind of a template for a professional courtesy policy with the FAQ sheet. Happy to share that with you guys as well. We can send that. And then there's the whole time of service discount. This one always excites me when a practice says, the only thing that I do is a time of service discount. So let's just check off a couple of boxes here when it comes to time of service discounts, also known as prop pay discounts, must be paid at the time of service. Time of service discounts must be legally defensible and reflect the actual cost of bookkeeping and admin. Not just, I feel like this is a great number, but did you actually see what it cost you for the stamps, for the envelope, for all of these different things, for the billing, for all of those things? That's where all that comes in there. I believe the number is around 8%. Even for a high volume practice, typically their admin costs for time of service really are anywhere between 8 to probably 10% at this point. So a 30% time of service discount is not a reasonable time of service discount. Practices will often state that that's their number. I give about a 30% discount here for these services and 50% over here for these. So that is not a time of service discount. Remember, your federal law is always going to override your state laws, especially during an audit. And one of my other favorite things, I'm just going to throw this in there, is an auto debit. Absolute favorite thing. Payment schedule versus what I kind of call buying groceries is super important. If you've got patients on auto debit, then they don't really have to make the decision. They're on autopilot with getting their care. And cash practice is one of my favorites. However, there are many auto debits out there that you guys can choose from. I think it's a critical part of a practice. As we've evolved as consumers, we just kind of expect things to be on autopilot. Most all of my bills are on some form of an auto debit. So if you're not doing an auto debit, I encourage you to look into those. So I digress. But the other piece about all of this that kind of comes together, knowing your number, all of these different things and setting your rate, is obviously the financial report of findings. So many practices miss this incredible step. This is vital to a successful practice. Knowing your number, all this kind of generates together. And even if practices I find that do financial report of findings, they don't do them consistently, which is something that should be a part of the process in your office. This is literally setting the table for care. Literally setting the table for care in your practice. It's going to create value. It's going to be transparent with your patients. I think that is incredible when you're able to lay it out. Here's what we're going to do for you. This is going to, in return, create better patient retention. 60% of the time, the reason a patient leaves is because of poor communication. 60% of the time. This is their first reason. When I left, the first time I went to a chiropractor's office eons ago, I left and never went back because there was no communication. At that point, I'd swore off chiropractic at that point because truly this doc must be like all docs. I was mistaken, sorely mistaken. But I left that practice because of poor communication. So I fall into that category. That's not what you want for your patients. Set the table for them. Last but not least, and some of my docs may not agree with me on this, if the doctor is delivering the financial report of findings, I challenge you to let it go. Give it to a team member. Give that to a team member. Now, if you are a CEO, a chief everything officer in your practice, obviously you're going to do the financial report of findings. But if you do have a team member, I challenge you to give that to a team member. Our doctors are looked at as the compassionate. They're going to provide the care. The best course is to say, you know what, I'm going to need you to talk to April out here, because the last thing I want to do is really frustrate April. She knows the numbers. She can tell you what's next for you. So give that to a team member. So now that we know how we're going to raise our fees, even if it's just by $5, when do you do it? So obviously now would be a great time. summer or fall, beginning of the year. Obviously, what this really translates to is any time is a great time to do it. Obviously, here we are at the end of the year, so I would encourage most practices, and I tend to see a lot of practices make this change towards the end of the year. They'll begin reviewing their numbers and setting up their next year. So your patients expect change, by the way. This wouldn't be new for them. 2022 should be a time for change for everyone. We've got to kind of take the next step forward, but we are accustomed to change at the beginning of the year. Deductibles even reset. So this is the great time to step back and look at that. Here's what I do suggest though. If you can or you can't, is to at least give a patient about a 30-day notice. Not required. I think what we're doing here is just kind of communicating with our patients and letting them know that we've made some changes. And my go-to thing is to blame the government. There's no reason to not blame the government for any of this. Figure out a way to do it. And I'll help you with some of your scripting if you'd like me to do it. I do this all the time. It's the God honest truth. Blame the government, not politics. Set all that aside, but blame the government for a lot of the changes and all the hoops that we have to jump through within chiropractic as well. So let's recap before we get into any questions that you guys may have. I challenge you to know your worth, calculate your number, look at what your overhead is and figure that number out. My number is 35. Well, you've only been charging 30. You're leaving money on the table. Charge your number and what you're worth. Utilize the free resources. I bet most of you had no idea that these resources were even out there, much less free. So utilize the resources that are at your hand. Look at your provider agreements. Look at your contracts. Do that often. Please make sure that you are reviewing those contracts yearly, if not twice a year, and update your rates. If you want to see better reimbursements, update your rates. Drive those reimbursements up, guys. I'm serious. If you want to see better results, make the change. Make the change. Here are your resources again, your fairhealthconsumer.org, chirocode.com. We can get you the overhead calculator. We can get you copies of professional courtesy policy, templated documents for that. Same thing with a hardship policy. And then making sure that you're discounting properly. Understand that raising your rates might scare you, and how are you going to pass this on to patients when we've been discounting? All of these different things. This is what we're here for. All right. Are your discounts essentially putting you at risk? Are they good? Are they bad? Are they illegal? All of those different things. If you're not already familiar with ChiroHealthUSA, ChiroHealthUSA is three things. We are three things. I've broken it down. I've nailed it down to three things that ChiroHealthUSA is. We are patient retention. 1 out of every 2 patients on CHUSA stays with your practice. You've created lifetime patients with ChiroHealthUSA. That's not me making numbers up. That's legit numbers. ChiroHealthUSA is also profit. If you actually raise your rates and you set everything accordingly, even though you're discounting, you're going to be profitable. No doubt about it. You will be profitable. And obviously, there's the word that we don't like, but it's there and it's here to stay. It's called compliance. We are compliant for your practice. Legal discounts to patients with high deductibles. Medicare patients, patients who exhaust benefits, and even families, all done legally through a network. If you are already part of ChiroHealthUSA and you want to do a review, there's just not me. I have a duplicate. Her name is Ginger. She's also a network specialist. Get with one of your network specialists so that we can take a step and help you figure these things out. Work with your coach or consultants, whatever it is we can do to give you guys kind of those resources. I promise you, we are beyond happy to help. This is my contact information right here on the screen. You are welcome to email me anything. You can reach out to the team through our website as well. That's our phone number. Give me a call. Give the team a call. Whatever it is that we can do to help, guys. I'm serious. I'm happy to help. That's it. That's all I got, Christy.
Well, I got some questions for you, and I want to talk about this.
All right, fine. Here goes.
So, let's see. When someone is starting a practice and has no patient visits yet for calculating overhead, or, they're just starting out.
Right.
How do you recommend that they set their fees? Which is a great question because we get this one all the time.
All the time. You still know what your rent's going to be. An average, right? Whether you have the building, whatever that looks like, you've got somewhat of a number. But this is where I hands down say you're going to take the first 3 to 6 months and you'll begin creating your number. Let's go to ChiroCode. Let's figure out what you're going to start charging. What are you going to start charging? That way we can make sure we're at least profitable in that aspect. And maybe you need to move some numbers around once you've established some overhead.
Well, and I want to say that one of the things that is consistent, because you have a preference for the ChiroCode fee calculator. Mm-hmm. I have a preference for Health Consumer, but there really is no right or wrong. You can use either one of them. The 20 frustrates me, but you will notice what is consistent. Both of them ask you for your zip code because fees are based on where you practice. Because what's going to work in rural Mississippi, where I live, is not going to be the same for somebody who is practicing in a more urban area or like downtown or New York City. And because we work with providers all across the country, we see very clearly the very difference in charges. I mean, there are some people in parts of the country whose routine office visit fees, CAT fees, is more than what you would see in like a new patient initial visit.
Yeah. Oh, yeah.
Right?
Yeah. New York, and New York tends to stick out, that Manhattan area. I've got one, her routine office visit, and it works.
What the price is?
No, I'm not going to say the price.
Okay.
I know better. It's up there. Like when I say it's up there, but it supports her demographic. All of the numbers make perfect sense. Same thing like Chrissy's saying, Mississippi's going to be different from California. All of these places are going to be different. It is important because it is based off your zip code.
And I would really think about it too, is if you think about like gas prices around the country are so completely different. Yep. Like when my friends from California send me pictures of how much they paid for gas, my heart skips beats. It makes me not want to complain about my gas prices, even though right now I'm driving my son's F-150. And the first time it cost me almost $100 to fill it up, I was like, oh my gosh. I need a little car. I don't want to drive an F-150. Oh, bless it. Okay, well, thankfully that's going to end today. Okay, so I have a question that didn't pertain to you, but I'm going to go ahead and answer this for Scott. Is it legal to add a charge for using credit card processing? So here's what I'm going to tell you about this. Mm-hmm. There are state rules about what you can and can't do. You really need to reach out to your state association. I will tell you that American Express prohibits you from being able to do this. As part of your merchant agreements. You can probably even reach out to your merchant services representative, and they can probably help you answer that. But I mean, I thought that was a great question. We've been asked that before. I know that in some states you can't do it, and some states you can. Like I said, you just reach out to your state association or merchant services.
There are even states where, sales tax, you have to add sales tax on with the services. I think it's New Mexico. So it is state specific to things. So definitely reach out to your board or your association.
So we have another person who said, do you know how often fees get changed within the insurance companies? And I'd like to say there was a rhyme or reason, like they do that annually. They don't. They just do it whenever they feel like it. Just like they decide whether or not they're going to cover something.
Yep.
I'm sure y'all all get those updates from the insurance companies. You don't read them because they're like 40 pages long. It looks like a newsletter. And like nothing has to do with chiropractic. Except when it does, and we miss it because we stopped reading them like a year ago. So they just kind of go into a folder. True story with United Healthcare a couple of years ago, buried in like page 35 in a single paragraph. It said that they were no longer going to cover the chiropractic adjustment for the treatment of headaches. Mm-hmm. And nobody saw it. But like a handful of people, thankfully, some people reached out to their state and national associations. Who all got together with the Clinical Compass, Chiro Congress. They sent a letter disputing that, providing the research that proved the efficacy of chiropractic adjustments for the treatment of headaches. Before it ever went into effect, it got overturned. we would have all figured it out. The rest of chiropractic would have figured it out and we stopped getting paid for it. Versus the people who thankfully it got stopped. So my point is when you get that United Healthcare, Blue Cross Blue Shield, all those updates, open up the PDF, search chiropractor, chiropractic, like Control Command F.
Yep. That's about to say Command F.
Yep. Okay, this is what we do too. Like, no, I don't want to read all this stuff. I don't care about, I don't really care about anesthesiology,
right,
cardiology, oncology. I don't care about any of that stuff. So I just want to search chiropractor, chiropractic, and see if there's anything in there. Now, there's something in there and you're like, oh, wait a minute, they're no longer going to cover this. Notify your state association immediately and let them fight that battle for you.
Yep.
And somebody wanted to know, can you negotiate your fees with insurance companies? Yes.
Yes. This is what drives me nuts because you absolutely can. So many people just say it is what it is.
No, everybody else in healthcare negotiates their fees. So part of the problem that we've had over the last couple of decades, since the reign of the Mercedes 80s, if anybody's out there who practiced it during that time, please come tell us all about it. We love those stories. We know times have changed, but here's what happened is that if you think about, that one statistic that Heather posted was that 80% of chiropractors in most states are not even charging what workers' comp allows. So one of my jobs is working with state and national associations. And one of the battles our state associations are fighting is to prevent workers' comp from reducing reimbursement amounts, because obviously they see what is being billed. So if they're willing to pay you $100 for an adjustment and everybody is billing $70, why wouldn't they just lower the rate to $70? Why are they going to pay the handful of people $100 when the vast majority of the states is only billing $70? So that's why and typically workers' comp is the highest paid fee schedule. And again, it varies state to state. Some states have published PI fee schedules. We want you to evaluate all of those fees, but absolutely, if you're charging market value, and this is the other example. I wish y'all could see this because I do. I have 20 pounds of coding books. It's this tall. Thankfully, they're not chiropractic. Chiropractic's this big, my chiro code book. The rest of that is medical coding. But if I look at any code that we use in chiropractic, it's in my chiro code book versus my medical coding books, the descriptions are the same. We can all agree that your exam codes are being utilized by other healthcare practitioners in your zip code. Are they getting paid more than you? Yeah. Why? Are they charging more than you? Probably. They still have to meet the same criteria that you do. So we gotta bridge that gap. Okay, so let's see. Do you have an example of the letters to notify patients that you're increasing the rates? Do you have an example of that letter?
I've kind of played around with templating a couple of things for some practices, so I'll dig those out if you'll just shoot me an email. Whoever asks the question will just shoot me an email. I'll pull that out. I've done that in the last couple of months. It is not a legal document. It is my opinion. It's just to give you an idea on structuring, just having the conversation. A lot of times practices stop right there because they don't want to have the conversation. So if anything, it's just it's a way to launch you into having the conversation. So yeah.
Okay. You're going to love this question. Can you negotiate with Ash and Optum Health?
You mean pain in the ash?
Pain in the ash? Well, they're technically not an insurance company. They're more, they're the...
Like a third party, American Standard Health, like with Blue Cross, United Cigna, all those guys. That's just to each their own is the way that I look at it.
Yeah. Okay. Somebody wants to know, how would you go about negotiating your fees? Well, first you would just need to contact the insurance company and let them know that they're paying you well below the market value.
Exactly. That's your first step.
And then provide them with what you know, which is the market rates in your area. Meaning, this is what you pay everybody else. Here's the market value. These are my fees. Why are you paying me a quarter of what my actual fees are? Like,
you can have that conversation and still be a chiropractor.
Dr. Jacob, I'm reading can you clarify what you mean on this? Your question, because I see it. It's a good one. Set the rate compensating for the fee and then provide a cash discount. So it's a discount, not an additional fee. I'm not really sure what you're referring
to. So in other words, I think what he's saying here, and I could be wrong, Dr. Jacob, so if you're still here.
He said he's going to try an additional. Provide some additional info. But go ahead. You might be right. And I'm lost.
Well, like if the fee is I'm just going to random. If the fee for the service, that merchant service, I'm assuming is what he's saying, is let's say.
Yeah, I think that's overcomplicating the issue.
Yeah. I think what he wants to do is work that into, well, my fee is typically $100, but I'm going to work it into $103 so it absorbs the merchant service cost. Yeah, that's what he's doing.
It is. Okay, so I see what you're saying. Just before I would reach out to your state association.
Your fee is your fee at that point. I mean, that's I don't know. Maybe that's just being smart. My opinion that says, maybe you should set it at $55. It's part of cost of doing business, but you're not stating that you're charging an additional fee.
You just raise
for merchant services. You are absorbing what you're doing. You are absorbing all the costs.
Right. Well, and let's be honest. I mean, that is with more and more people, less people carrying cash. Everybody putting all of my bills are on auto debit, mostly because I just like to visit my house on Tuesdays to talk to you guys. And then I go back on the road and fly to parts unknown to meet you in person on the weekends. So because I'm never here, my bills would never get paid if it wasn't for everything being on auto debits.
Well, auto debit is a whole other conversation that a lot of practices miss out on that should be doing it. Dr. Jacob, you are super smart.
This is going to be recorded, so you should send her a link to the recording, Dr. Jacob. That's so funny. Okay, guys, any more questions? We love to let you out early. And I'm sad that we won't be together for the next couple of weeks. But the good news is we are going to start right back on January the 4th. And in fact, I'm so excited that we're going to have 2 webinars the first week back. We're going to have one on Tuesday and one on Thursday to make up for our time apart. So we're going to do Dr. Lauren. If y'all are listening to podcasts, she has a great podcast called She Slays the Day. And she's always talking about her social media wins and mishaps. And she is hilarious. And she talks about trying new things and what actually works to convert your followers into becoming new patients. And she is absolutely fabulous. When we were at that convention in Clearwater, Florida, we met Dr. Lauren. We got seated next to each other. And I have to tell you, that was the most fun conversation I had. And she won me over because I hate social media. If you follow me on social media, I hate it because I sometimes post for a whole week and then I don't post for a month. I can't do it. It's hard for me. Then we're going to talk about the No Surprises Act, which goes into effect in January. So we're going to talk about that January 6th with Dr. Scott Munsterman. It's super awesome to have somebody who likes to read 3,000 pages of an update and then breaks it down and says, okay, here's what applies to you and here's what doesn't. Well, who else we got coming in January? I might have if I'm scrolling on the right screen. We're going to be talking about personal injury. We're going to be talking about Biden tax law changes and how they're going to impact you guys as in your personal income. We're going to have our good friend Erin here to talk about the future of our workforce. Then we have Dr. Hillary, and she's going to talk about planning patient events. What does it really take to have a successful patient event? And some of her ideas are hilarious and fun, but she doesn't just talk about them I totally did this and it was successful. No, she has some pictures to show you just how successful they are. And her community is having the time of their lives partying at her chiropractic office and getting treated. So she has some great stories. You're really going to enjoy it. So we have some great webinars. So make sure that you're registering for those. We have some other ones that are going to be added soon. We have one coming up about business insurance, which is kind of boring, but we're all about making sure that your practice is protected. And part of that is making sure that you CYA, cover your assets. And so NCMIC is going to be here to do that one. I'm trying to think. We have a lot of really cool we have a lot of new people coming on to the webinars. And we're going to be talking about CBD. We're going to be talking about all kinds of hot topics. Not just the boring coding and documentation stuff. They will do that too. So my brother from another mother, Evan, will be back. Rest assured. And he'll talk about all that fun stuff. We're going to probably be talking about ICD, brace yourself, 11. It's coming sooner than you think. We're going to be talking about chiropractic research, the future of chiropractic, strategic planning. If you don't know what that is, definitely go and check that out. Chiropractic strategic plan. Let me find that website. We have so many cool things that are coming up. And again, I want y'all to tell me anytime if y'all have any recommendations for a new speaker, or if there is a topic that you're really interested in hearing about, let me know. And we have a whole bunch of new cities that we're going to be hitting up in the next couple of months. Not to mention, Heather and I are going to be speaking in Parker, Vegas together.
Yeah.
Bless your hearts. Oh, by the way, John Madrid is here, and he just confirmed that he is bringing his new wife to meet us.
Who said that? What?
John Madrid is bringing his wife to meet us in Vegas. I'm wondering what he said about her, or if he said about us to her before he brings us.
Oh, this will be fun, John. I love you. Congratulations. That coat was spectacular, and she was beautiful. But congratulations.
So I just posted the link for the strategic plan. So if you're curious about the future of the profession, it's in phase 3. You should definitely check it out. You can see what's being accomplished. Okay, everybody. We love you. It's been an interesting 2021. It's going to be an epic 2022. I hope you all have an amazing rest of the year, that you enjoy your holidays, that you get some rest, some relaxation, and you come back kicking butt and taking names in January.
That's it. And we're here for you guys. Thank you.
Bye, y'all.
Bye.